The eastern slopes of the Sierra Nevadas in California are popular, picturesque getaways. In the past, residents, both temporary and permanent, had to drive to Reno, Nevada, Truckee, or Sacramento for specialty health care. Now, an expanding telemedicine program offers more convenient health care that is available close to home. Portola is the only incorporated city in Plumas County, California, with a head count of just over 2,100 people. During the summer months, the population in this mountain community rises with tourists, but many of the residents make it their year-round home. For primary and emergency care, Portolans go to their medical clinic. But the distances to large cities, which may have been the drawing card in the first place for some of the residents, were working against them when it came to the need for specialty care. The California Telehealth Network now brings specialty care to eastern Plumas County.
This community is a long way from anywhere, as you know from driving up here, and our local patients find it extremely advantageous not to have to make long drives to be seen by consultants. It also is a time factor, of course. It takes a long time to get a patient into a specialist in Sacramento. So it's very helpful in that regard, and I think the community really appreciates that feature of it.
Loyalton in Sierra County, about 30 miles away, is just about as isolated, and it has less than half the residents of Portola. Despite its location, the community can now provide care to Loyalton cancer patients with one of the very few nationally certified nurse practitioners involved in oncology telemedicine.
We've been working with Tahoe Forest Cancer Center, and a lot of patients out here in this area do travel to Truckee, which is an hour north of here. In the wintertime, that gets kind of sketchy. So we're able to treat these patients via telemedicine with Dr. Heifetz every week. They don't have to travel. They're able to get the same care. They can get their blood work done here, tests here. So it's more convenient for the patients.
The day we were there, a psychiatrist in Bakersfield told us that telemedicine eases her Loyalton patients' anxiety.
They don't need to physically, even approach me and do that. I'm in the television. I still can talk to them. They still can listen to me.
Mark Schweier learned a lot before and during the startup of his telemedicine program and knows what he would tell others in his state who may be considering one.
Well, first of all, I would take the time to visit somebody that's actually doing telemedicine at a successful level. Look for those areas in facilities and centers that are doing programs that you see a need in your community to get up and running. And then most importantly, really reach out to the resources that are there. Reach out to the California Telehealth Network. They've been great partners for us.
Schweier says return on investment is important, but people often overlook the hidden value-added services that a telemedicine program brings to an organization.
Absolutely. One of the things that we realized that we're doing is we're rebuilding confidence in our community. We've heard a number of comments from our community that the confidence is building back up again, and their desire to remain here in our setting and feel like they can be taken care of well is really building much quicker than we had anticipated.
The California Telehealth Network began as a pilot program to increase access to acute, primary, and preventive health care in that state. Now, CTN is using its network to leverage that investment to advance the telecommunications and healthcare technology. Once complete, the network will connect more than 800 California healthcare providers in underserved areas. Telemedicine is the future of healthcare, but it is here now and it is working. I'm Roger Downey.